Good morning. What a piece of calamity. Oh my goodness. Are you generous? Are you a generous person? Would you take up somebody from off the street and bring them to your house? To bed? Oh, oh my goodness. Why would somebody do that? Mm. Oh my goodness. Somebody you know that was on drugs. Well, anyway, can't tell people what to do. But some people just overdo it. All that. Oh, my eyes keep running and mm. I got the appointment for surgery. Woman, do that. Oh my God. Oh, will I? Oh, we're faithful. And I will always love you. How many YouTubers you watch, and sometimes you say, "Is something wrong with these people?" Hmm? I guess if they be more generous, YouTubers will YouTubers will give them more paycheck. YouTube will give them more paycheck. We gotta try some of that strategy too, should we? Because I'm sure not doing the right thing. I'm sure not doing the right thing. I'm sure not doing the right thing. Probably across down the street, there's a lot of people who want drugs. Gone. That's a weird outfit. Why would you have that stuff that's gonna stick you? Mm, 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 mm. Every breath that I am faithful, I will sing of the goodness of God. I love your love. Mm. You are present on the fire of my days. Mm-hmm. Yeah, but would you just pick up somebody off the street and bring them to your house to take a shower? What kind of bullshit is that? Mm? That's mentally disturbed. Mm. All my life will have my soul. Mm. I'm not that generous, okay? I'm generous, but I'm not that generous to bring somebody up in my house to go bed. Mm-hmm, mm-hmm. I'm sorry. Mm. And I guess the bathroom now scrubbed down with bleach anyway. Oh, her. Mm-hmm. 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 All my life we have gone home. So good. Mm-hmm. Some people out there who defend in the cars. Tell me the honest truth. When you bring somebody up in your house, you pick up off the street to go take a shower. Mm-hmm. You would not. You would never do that. So how you defending a cause that you're not gonna do it? How? Mm. Or just to look good in people's eyes, you wanna say, "Oh yes, oh, you." And some of you know you have family member who's on drugs too, and you don't even look for them. You don't even go looking for them. And drugs and mental problems. And if you make anybody know that they're your family, that's the worst thing on earth you could do. You know? Mm. What you watch your emotions. Mm. all my viewers at, where they went to. So me you just staying in the background. Watching from the background is not gonna help me. You see why you never take up people and say you and them as counterpart? People are disappointed in a heartbeat. Mm-hmm. They sure will. This one I was original. All my life you have been so, so good. Every breath that I am feel. Kia Center. Nice. Kai. All my life you have been so, so good. Kai. Welcome, Kai Kai. What's the surgery called? The surgery is called double mastectomy. Let's see if anybody who did the double mastectomy. Double mastectomy. What do you have to say about it?
Now we go to new research regarding breast cancer treatment and what it may mean for women making surgery choices. Joining us now is ABC medical correspondent and our friend, our favorite doctor, Dr. Darian Sutton. Nice to have you as always. So pretty much everyone knows someone affected by breast cancer, and this new study is looking at the different ways women are treated for breast cancer and the outcomes. Break this down for us.
So this study is focusing on the surgical procedure of mastectomies. That's technically the surgical removal of breast tissue. The goal is to reduce the risk of a new diagnosis of breast cancer later on in life. Some women, 100,000 women, are undergoing this procedure each year. Some women choosing to do the more aggressive approach of removing both or bilateral breasts. And this study looks to see what is the benefit in that. It found that although it reduced the risk of breast cancer, cancer, it doesn't change the overall survival. In this study, they followed more than 300,000 women with the diagnosis of breast cancer, and they looked at those who chose different options. And for those who got a full or bilateral breast mastectomy, they found that they did have a reduced risk of breast cancer, but the overall survival among all groups was relatively the same. Now, these are important, but it's also important a factor to understand that women have different risk factors, and this wasn't truly considered in this study. So when you're making that decision, it still comes down to that patient and their provider.
So what does this study mean for women who are newly diagnosed?
Well, I think number one, the option and the understanding of a mastectomy is a personal one. It is unique and it is complex. And when you're making that decision, you should take into effect all of the other risk factors. For example, genetic history, family history, a personal history of cancer, even a prior history of radiation. And then that goes into that decision, weighing up against the risk of surgery. Again, it's unique and personal and complex for each and every person, and there is no wrong answer. Rhiannon, I think what's most important is that regardless of your decision, you make a plan for proactive screening of all cancers after that. And you want to make sure that you're staying up to date with all recommended screenings.
All right, very important information. Is it surprising?
It's not surprising. I would say that the risk reduction in terms of risk of breast cancer reducing is surprising or helpful to know, but the actual risk of death is not. And why? Because mastectomies, although they remove breast tissue, they don't prevent the risk of breast cancer cells going to other parts of the body. And so when we know that, then that understands the risk, or that creates a risk for a woman in general. So we have to pay attention to these factors.
Have to pay attention. Dr. Darian Sutton, thank you as always. Always a pleasure. Getting a mastectomy is a very scary and very foreign procedure for many women. Even if you've had another surgery, this surgery is different. But here's the good news. There are tips and tricks that can make your surgery recovery so much more manageable. Less pain during your recovery, less frustration because you know what to expect, and be able to get back to your life so much sooner. Here are 12 things that you need to know about a mastectomy, but no one's probably told you. In this video, I'm letting you in on those tips that nobody is talking about. Starting with tip number 1, you have surgery options. Keep in mind that you're in the driver's seat and you have surgery options. There are options for reconstructive surgery like deep flap or implants, or you can opt to have no reconstructive surgery at all and just go flat. The FDA states that women with breast implants that have a textured surface are at a very low risk, but a risk nonetheless, of developing anaplastic large cell lymphoma. The treatment for this type of cancer is removal of the breast implant, along with the cancer, as well as chemotherapy and radiation in some cases. The actual risk of developing anaplastic large cell lymphoma is very low. 1 in 30,000 women with textured implants may be at a risk of developing this type of cancer. When we look at the big picture, breast implants are actually really safe, but this low risk might still be too much for some women. Most women who are undergoing a mastectomy are doing so because they've been diagnosed with breast cancer. The idea of having a reconstructive surgery option that would then in turn increase your risk of a different type of cancer, well, that's just too much for some women, so they don't want to go with that option. Of course, if implants are a good choice for you, then that's great. Just know that there are other surgery options for you, like the deep flap or just flat closure. The deep flap surgery is when fat is cut from your lower belly and actually moved to your breast area to rebuild the breast. You're essentially using your own fat on your body to recreate your breast. This is a rather specialized surgery, so not all hospitals or all surgeons will be able to offer this. The recovery time with this type of surgery is also a little bit longer because you do have that incision in your abdomen. So it's going to take a little longer to recover when we compare it to implants or just flat closure. But flat closure or just going flat, that's also an option to consider. There's becoming a lot more acceptance around just going flat. Many women do say that they do feel pressured by their healthcare team to undergo some type of reconstructive surgery. There is a misconception that women may feel self-conscious or incomplete if they don't have some type of reconstructive surgery. Every breast cancer thriver is completely different, so you need to consider your options specific to you. There are many women who feel very confident and comfortable with flat closure, but there are other women who are very happy with implants. Whatever your choice, it's valid. Do your research and know that if you are uncomfortable, keep pressing for other options. You have
Double
choices. Next up
mastectomy
is
did
tip number
set.
2, and this is actually good news about your mastectomy. I know, there can be something that no one will tell you that is actually good news. Your incision will not be bloody, gory, and gross. When you remove your bandages after surgery, your incision is not going to be bloody and gross. Surgeons take a lot of pride in making sure that their incisions are clean, tidy, and precise. Many women think it's going to be a gory scene after a mastectomy, but it's just not true. For the most part, many women might feel a little unsettled by looking at the transformation in the body, or they might feel like their incision actually makes them feel kind of uncomfortable or squeamish, but it's not going to be bloody and gross. Now, along with the incision from your mastectomy also comes drains that are required as part of your surgery. Let's get into more about these drains and what they don't tell you about these JP drains specifically. JP drains are in place for up to 2 weeks and are a necessary part of mastectomy surgery. The drains are located on both sides and actually collect fluid as part of the healing process. The fluid is called seroma fluid and is actually created as part of the healing or inflammatory process. But here's why it is so important to remove this fluid. Removing the fluid helps with healing and removes the pressure off of the incision. We want to avoid collection of fluid under the skin and allow that incision to heal properly. Okay, but here's a really surprising thing about these drains, and more specifically, the fluid that comes out of these drains. It's normal for the fluid that comes from these drains to change color over time. The fluid is collected in small bottles, and as your body heals, the color of that fluid will change as well. First, the fluid will be a bloody color, then it will change to a slight pinkish color, and then eventually to a pale yellow. This change is happening as your body heals. Different cells are involved in the healing process, and as such, that fluid color is going to change over time. This is actually really linked to the most surprising part of a mastectomy, which I actually touch on at the end of this video, so keep watching until then. Tip number 5 about your mastectomy is a really important tip about driving home after your hospital stay. After the surgery, you're obviously going to be experiencing a bit of pain. But what most women don't think about is their actual drive home from the hospital after their surgery. When driving home, every bump and pothole is going to cause a little bit of pain. With these movements or bumps, it's going to cause pain when normally you wouldn't have even noticed this at all. Of course, whoever's driving you home is going to be completely unaware that it is actually causing you pain because it's not bothering them at all. So here's what to do to prevent this painful trip. First, change your route and pick a road that's really smooth. For me, the main street that leads back to my house is full of bumps and dips and is really unpleasant to drive on after surgery or after chemo. Normally, when I'm driving home, it doesn't bother me at all. But when you're in pain or feeling unwell from chemo, this is a big deal. So instead of taking this main route home, my husband would take a secondary road that was way smoother. It might take a little longer to get home, but it's a much more pleasant drive. This was such a better option for me after surgery. If we were to take the main road home, it would lead to bumps and potholes, and I would quickly have to say something to my husband who would otherwise be completely unaware. The second thing you can do on the drive home to minimize the pain is so simple, but hardly anyone will tell you this. Soft pressure on your chest can make a big difference. Bring a pillow along, or even if you can bunch up a coat or a blanket and hold that on your chest, because that will help minimize the pain. It's these simple but really practical tips that can make a huge difference in your mastectomy recovery. I'm so happy to be able to share these practical tips with you. Not only my practical tips as a cancer survivor, but pairing that with my knowledge as a doctorate in cancer care. Once you get home from the hospital, you'll want to make sure that you're comfortable and able to rest. And that actually brings me to my next tip, which is sleeping after a mastectomy can be really tough. You might not realize that you're not going to be able to sleep on your stomach or even your side for a really long time. For women who sleep on their stomach or their side, it can cause a lot of stress and anxiety around how are you going to sleep? But most women adapt to this quite quickly. Your body's going to need to rest and heal, so you'll adapt to the sleeping process quickly in order to allow your body to do that. Now, naturally, you won't be able to sleep on your stomach because of the incisions, but you're also not going to be able to sleep on your side because of the drains. That leads you to just sleep on your back. but just laying
Sleep on my
flat on a
back.
bed is actually not an option either. You'll need to sleep on your back, but in an inclined position. Recliner, elevated bed, or using pillows. Try any of these options and find the one that allows you to get the most restful sleep. Now, there is something that I need to share with you post-mastectomy that I am sure no one has told you. Your armpits, they're gonna smell weird. Most of your time is gonna be spent with your arms down, straight by your side. Because of this, there's really not gonna be much room for air movement in your armpits. As a result, there can be a really stinky, almost like cheese smell from your armpits. I bet you no one mentioned that to you. Obviously, this is stinky, but not harmful. But if it does bother you, well, here's what you can do about it. Try to just gently clean the area. Even if you can lift your arm just slightly away from your body rather than up, then you can get a flattened washcloth in there to clean the area. A breast cancer thriver that I work with in the Cancer Freedom Program had a mastectomy that went straight to implants, and she found that the smell of her armpits was almost unbearable. She compared it to the smell of blue cheese, and she hates blue cheese. In the first few days post-op, she would use a flat washcloth and slide it between her body and her arm to wash the area. And then when she got further out from surgery, she tried using spray deodorant because that way it put no pressure on her armpit at all. Which actually leads me to my next point. A mastectomy is most often more than just one surgery. When working with breast cancer thriver clients, it's often a very common misconception that a mastectomy is just one surgery, one and done. But that is simply not true. If you select a mastectomy and then implants, you're likely going to have one surgery for the mastectomy, one to put in the implants, and then likely a third surgery to do any revisions that you may want. For some women, this can even continue into multiple revision surgeries. Just keep in mind that depending on the surgery option that you choose, you may be having more than one surgery. That brings me to my next very important point. This is something that breast cancer thrivers are really concerned about surrounding a mastectomy, and I'm betting that you care a lot about this too. Most women are really concerned about being in pain after surgery, and that is completely warranted. Because of this possible pain that you'll be in, you're likely going to be prescribed various painkillers. During surgery, many women are given an injectable painkiller right into the incision that will give you pain relief for about 48 hours. After that, you're likely going to be prescribed various painkillers that will give you relief for the next several days. But here's what you need to know about painkillers. If you don't stay on top of this, it's going to cause you a lot more pain later on. Painkillers are very constipating. If you've ever struggled with constipation, then you know that this can really impact your life. This is a really important issue, but even more so when you're recovering from surgery. Really, the two should always go together. If you're prescribed a painkiller, then you need to be prescribed something for the constipation. This could be over-the-counter drugs like Restorelax or Senecot, just something that's going to help prevent the constipation that these painkillers can cause. This can sound so trivial, right? Like
just
constipation,
listening,
this is not a big deal. But
let me pause this. They call me and schedule the appointment for the surgeries. I'm just trying to watch videos to learn. Okay, you know your doctor will tell you, okay, everything's gonna be all right. It's a simple surgery. But when you get into the operating room, yeah, it's simple. They're gonna have you under anesthesia, so you ain't gonna feel no pain, but they do it on a daily basis. Yeah, you'll be okay. God is in control. So I'm just listening to.
Now, you're gonna regret it later. Which actually reminds me of one more thing that you need to know about your drains. Speaking of being uncomfortable, we need to talk about how you're gonna feel when those JP drains are removed. Getting your drains removed can be uncomfortable. The day you get your drains removed is a day that many thrivers look forward to. Of course, these drains are annoying and uncomfortable, but some women find that the drain removal can be also uncomfortable and maybe even a little bit painful. Just prepare yourself that it may not be the smoothest transition. Many women also wonder about when they'll be able to return to work after a mastectomy. This obviously needs to be individualized to you, your body, and your job, but we do have some rough...
This is like 2 surgery in one. I'm removing the breast. The 2 doctors gonna be in the same room. my regular doctor, the cancer doctor, she's the surgeon. She's gonna remove the breast, and then the other doctor, the reconstructive doctor, then he take over and do this
Guidelines
thing.
about how long this will take. Now, if you have a desk job that has little to no physical activity involved, then you could be cleared to return to work
Are these
in
people
as
listening
early
to
as
that
2
thing?
weeks. But if you need more time to heal, or if you have a job that requires you to walk or do some light lifting, overhead even,
Oh, God.
then this can take up to 6 weeks before you're cleared to return to work. And that leads me to my 12th tip. The 12th thing that no one will tell you about a mastectomy. This one is huge and really impactful to the rest of your life. Number 12 is all about tips on how to minimize your scarring. There are 3 key things that you need to know about how to make your scars look the best they possibly can. All of these strategies can be used once your incision heals a little bit. So be sure to touch base with your team to make sure that you're all good to dive in. First, you need to keep the area moist. Apply lotions or oils. There is some literature to support that vitamin E will actually help with the healing process and minimize the appearance of scars. But you do need to apply lotion or oil several times a day and make sure to just keep that area moist. The second thing that...
But right now I have this really bad I don't know, black mark that came up under my breast, and they said, the doctor say, you need that to go away before surgery. Can you see it looks like a fungus? But he gave me a powder to put under the breast. So it's looking a little better than last week, I think. So hopefully it'll be completely gone by the next time I go back to them. I think I have to go on the 6th. The lady just called and made the appointment. The 6th. But the 6th is to just for them to tell me what I need to do before surgery and stuff like that. I think this, she said the 29th for the surgery. But I have one more chemo that's coming this Tuesday. So after the chemo, I have to wait 4 weeks for the chemo to be out of my system.
You can do to minimize the appearance of your scars is scar massage. This is a big one. If you're going to take anything away from this video, let it be this. After an extensive abdominal surgery, I have a scar that runs the full length of my torso.
Wow.
Obviously, this level of scarring can impact you physically from all the scar tissue, and the appearance can also be very extensive. But I use scar massage twice a day for 20 minutes each time. Massaging in all directions, all around the scar and on top of the scar, that makes the world of difference. My scar is barely there anymore. You can barely see it. The scar tissue is so minimal, it does not impact my day-to-day or when I go to the gym. Now, the last thing you can do to minimize the appearance of scars is to use silicone strips. Silicone gel is also available, but a silicone strip allows for more contact time on the area. You can wear this on the scar overnight, so it has more contact time for that 8-hour period and allows for better healing. In the long term, silicone strips have been shown to reduce redness and thickness of the scar. They're definitely worth the investment, and I've actually put an Amazon link right below to a product that I suggest to make sure that you get high quality medical ingredients and something that's designed for after a mastectomy. But here's the truth. If you're a breast cancer survivor, then having a mastectomy is just one piece of this entire cancer experience. And you know that. To really feel prepared and to make sure that you're doing everything you can to prevent a cancer recurrence, then you need to watch the next video I've linked up here, Tamoxifen Secrets. This is important stuff for you Thrivers, so let's get into it now. I'll see you in there.
Should I take tamoxifen? Why didn't I press it?
This is part of the journey, and we're going to take this next step.
Well, some people just go in the thing and then do the recording. This doctor don't want you to record nothing. I see that stone. They say I'm not even staying overnight. It's like surgery, recover for a few hours, then stay home. Mm-hmm. I got that stone that I build, I refuse. Breast cancer double mastectomy. So they told me, hold on. My doctor told me that I only have to deal with the, cause the cancer's in the left breast. And so I put the phone up on the tripod. Hold on, let me put the phone on this tripod. I don't know why I have the phone down here. So let me get this annoying thing off. I move this. I take this shit off again. I got to stone the bubbles. Okay, the bubbles. Okay. Mm, how is it song then? Let's listen to the song. I got the stone that the paper refuse. I'm like the stone. Okay, song okay. So yeah, the doctor said I only had to take off the breast, the left breast, the one that have the cancer. But when she sent me to the reconstructive doctor, he stated that I should remove both, which I was telling her I want to remove both because she said, like when you do surgery, then they make the breast way smaller. Because right now we're 42 double D. And when they do your breast, they're going to turn your breast from a D size to either A cup or B cup. And it's sure not going to go back to 42. It's not going to go back. Oh, so I might end up being a 32B or 32, whatever. God knows. So it's better you take off both because she was saying, okay, you have to take off one. But she said her job is just to remove the breast. So she didn't know exactly. So that's why she sent me to the other doctor for him to tell me the best option. So he said the best option is to just remove both of them at the same time. Which I was thinking, like, why would I want to remove one, then go back and do another surgery? If I have to feel pain, you just feel the pain, both of them at the same time. Remove both of them. Some people keep it flat. You can keep it flat if you want to. You don't have to replace it. I used to watch this Jamaican lady on TikTok. She cut both of them off. And she be on TikTok with no shirt on. Okay, I know you have them cut off, but you're still a lady. Keep a shirt on at least. I don't know if she still have the show tab. I haven't watched TikTok live in a long time. Okay, if you could have both of them and don't replace them, you feel like okay. You feel like a man now with no breasts. So I need something replaced there. What's that? Until he died. I'm like the stone. I'm like the stone that the better refuse. I don't even want to think about it. I just pray that everything will be okay when the time comes. Mm. I pray that this crap don't come back no more. Mm. The last time my breast was 30 something. It was maybe when I was a teenager, God knows. I don't know. Oh, this is, I made a video this morning with the thing under my breast and but I kept it, it's unlisted. That's like underneath the breast, the scar. But I think this video was, the picture was from the first time. I don't think I took a picture since. But I know it's clear up. It's not looking like this now. The rash is kind of going away now. Should I put it out? I don't know. Boom, boom. I don't think my breast is showing. Da, 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 da. That's just under my breast. Let's see. As long as YouTube don't block it. Mm, mm, mm. I like that stone. I made some videos on TikTok. I may upload them. I am anointed to put the enemy. I am anointed to put the motivation. Donna British TV, are you still here? Mm-hmm. My eyes are so heavy today. I don't know. You put the enemy under my feet. I am anointed. Mm-hmm. This thing is not showing good because I have the bubbles. Let's see if I take out the bubbles. What it's gonna look like. How the fuck you take this out? I can't deal with that. I am anointed to put the enemies under my feet. Oh, she got light.
I'm gonna take this one is a food supplement. This is not glycemic. No, this one I don't have. This is magnesium citrate.
Oh, she down to live. Okay. I am anointed. How do you do the live and get the picture up? I've been trying every time I try to do the live to get the picture come up. It's like it's not doing it. Mm, 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 mm. Anointed to get the enemy under my feet. I am anointed. Okay, where this highlight came from? Which live is this one? Oh, I don't take a highlight from this live already. 5 minutes. I hope it's not at the beginning because the live wasn't even running at the beginning. I forget. It was off. I am anointed. Okay, from 52 to 57. Okay. Mm-hmm. Look at the enemies under my feet. I am anointed. Strength of a woman. Oh, you hear that? Jimmy Campbell's show is suspended because I guess he was talking about Charlie Kirk death. Mm. We want to say stuff about what's going on in the internet, about people on the internet, people in power. Keep it off your channel. Mm. His show is suspended indefinitely. Can you imagine? He should know better. Even though you think something bad, you keep it off air. You say it when you're off air. You say that stuff on air, people hold you accountable. When they know wrong is wrong. Why is it partially black? Use it take less than 20 minutes, but sometimes I do, and it's not. At this point, to monetize this, that should this copyright. Because of these songs, I am anointed to the hallelujah from my feet. I am anointed. Mm, 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 mm.
Oh, it's a French baguette. Baguette. I got the French. Good morning, Ben Smith.
Mm, mm. Oh, this day hurt in my backside. I gotta get up off of it. Hurt in my bottom. March and rally for charter school across Brooklyn Bridge. At the school, I'm walking across the Brooklyn Bridge. My Savior. My Savior. Who will fall is approaching. The leaves are dropping. Leaves are dropping like hot bread. Trusting God, you would never. Hello, and Alex TB. Come on, people, I'm getting something to eat. I'm getting that bagel that I got for breakfast. I didn't eat it. You want some? This bagel have so much stuff all over it. I don't buy this type of bagel, but I got it. Oh, fudge. But nothing wrong with them. I don't know what this stuff on it is about, but it is alright. I cut it up. And so, put some cream cheese in it. Please. I'm getting my bubbles off. I remember how to take off the bubbles. And I cut it up now. You guys want a piece of bagel? Mm. A bit of orange juice. Yeah, as the topic says, double mastectomy and reconstructive, reconstructive surgery. Great. Yeah. So as I said, both surgery just it's gonna happen back to back. Mm. We set it for almost to the end of October. Mm, mm, mm. Okay. Surgery, rest for a couple hours, then come home. Mm. But when I come home with like two tubes connected to the breast, that's gonna be draining out fluids. I think I have to keep it in for about 4 weeks or so. Mm-mm. Who's here with me? Anybody ever did any surgery on your breast? People do surgery all the time on the breast. Some people do surgery to make the breast bigger. I think it's basically the same technique. Mm. But this one, I'm removing, well, not removing them, just making it bigger. But this one, I'm removing them because of breast cancer. Removing them and replacing them. Guys, please subscribe to the channel. And if you have not signed up a super chat, if you're currently do so, we accept super chat over here. Or if you want to send something to my cash app, it's $ Andrea F. Jiggle. Is it pinned to the live? I think it's pinned to the live. Let me double check. Mm-mm-mm. Reconstructive. Reconstructive. Did I write this thing? No, 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 no. I was about to write something else. Mm. Let's see something get the 4K. You guys not doing the stuff right. Mm-mm. 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 I'm a S-T-E-T-E-C. Oh, the old style jeans coming back. So all the people who never want to wear big legged jeans back then are coming back in style. Mushroom. Bigger t-shirts don't have no salt in them. Mm-mm. I watched Queen. Sorry, I didn't. I wasn't looking. I'm okay. How are you doing? Okay, huh? Let's alter your life. I'll keep this one here. Going on to us. I was okay until these people called me with my surgery date. Okay. Yeah, next month. I have one more chemo to do this Tuesday, the 23rd. And I have to wait 4 weeks till the chemo is out my system. And I have to do surgery on the October 29th. They just called me and tell me the date. Yep. Okay. The doctor says she thinks it's the best thing to do since it's the second time the cancer come back in the same breath. And when I went to see the reconstructive surgery doctor, he said the best option is to remove both of them and then replace. Because when you do surgery on one breast, it becomes very small. Because I'm at like a double D cup right now, 42. I'm at 42 double D right now. And you see, when you do the surgery, I might come down to either A cup or B cup. Child, I look like I don't have no breast when I'm done. So it's better to do both of them and get it over with. So both doctor will be on the surgery room. One doctor will take the breast off, and next doctor will replace them. Take the fat from under the breast and turn it into a breast. That's what he said he's gonna do. The lady was telling me there's different option. You could either take the fat from your back. Yeah, I know. I'm not worried about it. Take the fat from your back. You said you could have take, but she said you could have take the fat from your stomach. But then I found that that surgery takes a longer time. Takes like 8 hours to do, and sometimes most insurance doesn't cover it. So you said the one we're gonna do is called I think it's a Goldilocks surgery or something like that. So you see, when you take off the breast, there's fat and stuff that's under there. So you take that and just turn that into a breast. Well, he said it's Goldilocks surgery. Just pray that this mess don't come back. Because when you ask them, you cancer ever come back after that? They say they have no control. Obviously, they have no control over the cancer, and they say cancer could still come back. But the devil is a liar. I don't want to be. I don't want no more. I don't know if it's what you eat. I have no clue. I'm freaking tired of this. Especially when they do chemo. Chemo make you feel so bad. It's not. My fingernails are hurting me right now, real bad. That's due to the chemo, I think, mess it up. My toenail feel like it won't come off. Last time my toenail had come out, like lift up from the nail bed. I had to go to a doctor for him to fix it back for me. And that's what the feeling I'm getting right now. My nails them are sensitive. It's so look how red it is. I don't know. It hurts real freaking bad right now. Mm. The main thing is what we eat. You don't know what to eat now. You eat something that's they say is good for you. Then next thing you turn around and tell you it's not good. You can't trust these stuff. Well, they have no control. I don't think they have control of what what is good for you and what's not good for you. You know what I'm saying? They just tell you what they learn, but after a while, when they do different studies and see that it affect your body, then they change their mind and tell you, okay, then that stuff is not good. My head cool right now. Mm. How much stuff I had on my head? bald head getting cold. So you know we're ready to slip into fall soon. Temperature changing. It warm up a bit right now. Maybe because I just drink that thing. So after the surgery, you have like two um, tubes coming out the breast and a bag to collect fluids. But you have to keep on for like about 3 weeks or so. You keep it on. You just keep emptying the bags when they full up. But they say I'm not gonna feel a lot of pain. That that's what they say. What surgery you do don't feel pain. You be jacked up on medication, so you won't feel no pain. Then of course after all that medication wear out your system, you'll feel pain. But they say you come home the same day. Well, obviously they give you pain medicine. The last time when I did surgery on my knee, they give me um no no to me. Well, you didn't see nothing else after that. They gave me this medicine called oxycodone. I don't like that pill. Oxycodone is not cool. All that medication do is make you feel high as a kite. Don't even take the pain away for long. Yeah, I don't know what they're talking about. They just saying that just to put, not to put fear in your head. Of course you're gonna feel pain. Why the hell you're not gonna feel pain? Mm. Okay, before the surgery, when they take you to the, as soon as you get there, they connect they put a stuff in your hand. Then before you even leave that room, because I know when I did the knee, before you leave that room, they already inject some medication into you. That's already start getting you drowsy. Sometimes they have to give you double. Cause I remember when I did, what surgery I was doing? Was it in the knee? Can't remember. I was doing one surgery one time. And when we got to the room and I think they were going to give me a shot in my back or something like that. I can't remember. Something they were going to do. And I was feeling, you sending off the car, love? Why? Oh, my foot's swelling up. I don't know why. I need to put my foot up. I shouldn't eat and lie down on that, but I feel so freaking sleepy right about now. I don't know. My foot like a balloon. I don't know why it's swelling up like that. For the last 3 days, my foot's swelling up. 4 days. Ugh. Yeah, I remember doing before the surgery, and they give me some medication to make me drowsy. But when I got to the room for them to do something else, they go give him. I was like, damn, I feel that. They said you did. I said yes. Then they had to jack me up with more medication. Then after that, I, I passed out. I don't know what happened after that. until they were waking me up from recovery. Oh, damn, got hurt. I couldn't even talk good. But I was like, yes, no. That shit was awful. They thought I was totally numb or whatever. I think that's when I did my knee surgery. I think. Can't remember. I'm gonna start have major headaches. It's hard for people to say, "Oh, don't stress about it." They're not the one going in the surgery with you. Half the time, none of them not even coming to look for you. They'll tell you, "Don't stress about it," and they would never. Thank you. I don't even know what to say. I got it somewhere. You can see it. I did it live on the wrong phone, and I put up that bubbles. I'm trying to get rid of the bubbles. I can't figure out how to get rid of it. This chair, as soon as they lay down in it, sleepy gone too. I'm feeling sleepy. But there's a rash that I have under my breast. I did a video with it. With a picture that I have there, was when I just saw it, but it's going away a little bit. The doctor said the surgery can't happen until that rash clear up because it's like a fungus or something came up under my some stupid rash came up under my breast and he don't want that get transferred inside, so he gave me a powder to put on it to try to get rid of it. But it's clearing up. I was like, Rash, where the hell did you come out from now? You wasn't there all this time. All of a sudden, you just showed up from nowhere. Mm. Mhm. Thank God I showed them. Mhm. And some people will go to the doctor and then tell the doctor nothing about it. It's like, because it was itching me too. I'm like, no, something got to be done about this shit. Are you doing, how you do the bubbles? The bubbles, they go, I forget her. Um, Hold on, let me check it out on this phone. The live. After you hit the live, you turn on the live and there usually be some option at the bottom. You could get more than one different stuff now. It's like a effect. When you turn on the live, you see them at the bottom, at the side. I think it was at the side, on the right hand side. You have a lot of different options. It's like an effect that you turn on, but they don't have no good effects. But that's the best one I think. They. Am I doing lots of walking? Not really. My foot. I walk my son to the bus stop and come back. That's about it. I don't know why it's swelling up for the last 3, 4 days now. It's just swollen. I don't know what the hell is wrong with it. Both of them. But I'll be okay. I'll be okay. I'm gonna be nervous about. I don't have no daughters to look out for me, but hey, these sons of mine, if they're gonna have to look out for mommy. The other day I took my son to the doctor with me. Shit, I sure did. I don't have no daughter. I took him with me. Mm. I say, well, guess what? When the doctor not there to help me, and I need something, I'm in pain, and I need you to help me do something. Well, hey, you better show up for mommy. Remember, I took care of you when you was little. So you come and go with me and listen to what the doctor have to say. I sure did. But when he was in the room when the doctor said he wanted to take pictures, but I had him like cover his face and stuff. But hmm, the doctor snapped a picture of the breast and them when I went there the last time. Yeah, I ain't got no girls, so here. You have to look out for me. That shit gonna be painful. Oh my god. She said you could do nothing. You could remove one. That's what the surgeon was saying. The one she just do the surgery to remove the breast. So she was saying I could just remove one. But then she sent me to the reconstructive doctor. Recon and he said it's better to just remove both of them, which I was telling her I was thinking of doing that. She said you don't have to do it, but then she said this breast gonna be smaller, and then you have to do another surgery like to make this one smaller. So I was like, well, might as well just take both of them off the same time. And when I went to the reconstructive doctor, he said we take both of them off at the same time and just replace them so they'll be the same size. Some people take them off and leave their chest flat. You ever see a lady on TikTok? I used to watch a Jamaican lady on TikTok. She took off her breasts and she never replaced them. And she be there doing live with no shirt on. It's like, come on, lady. But I haven't watched TikTok in a long time. I don't know what her page name is. It's a lot, enough. It seemed like nothing right now, but I guess when you actually do the surgery, you're gonna feel different. Mm. And you're gonna say, I can't bear the pain. Yes, you can. By will or by force, I will have to bear the pain. Mm-hmm. I did two knee replacement already. Do I regret it? Yes, God, them suckers hurt still. Not pain from the surgery, but just they always getting numb, and sometimes I feel like the stuff in my knee just be locking up, and it's like I'm always hitting my foot. It's like come on with it. What is wrong with you? It's like sometimes this stuff wanna take over my knee. Like my foot, my whole foot is numb right now. I don't like it. I don't like what it does when you put them in. They say they take out the arthritis out of the friggin' knee. But then the complication of wearing these friggin' fake knee is not cool either. It's not. You know, like when you get in a cramp and your foot just numb. It's like your foot feel like that. Yeah, like your knee feel like that about 30-40% of the time. It's annoying. It doesn't wanna. And then if you walk too much now, like if you do a lot of walking, then you come back and it just start locking up on you. It's like, oh, fuck. What have I done? Did I make the right decision? Mm. It says cool is that cool to take out the arthritis, but damn it, wearing this prosthetic knee is no joke. I'm always hitting my foot. Stop, stop, act right, damn it, what the frig is wrong with you? I don't like it. I tell you the honest truth, I don't. But he had showed me like wasn't him because she had sent me to a different doctor before, but she said she didn't like the notes that he wrote. He had given me a lot of different options, and she said she didn't like it. So then she sent me to this other guy. He only deal with this other the doctor before. He deal with breast surgery and he deal with other kind of surgery. So this one she sent me to only deal with breast surgery. So he didn't give me a lot of options, and she said she worked with him a lot. So the other one was telling me I could put in the bag. It's like a bag with liquid in there. If that get popped, it's like. But I didn't like that choice. And he was saying you could take the fat from your back and use that to make the breast. Or you could take the fat from your stomach, which I was saying, yes, that's the one I want to do. And my stomach look like I'm about to pop a baby out. But then he was saying that surgery take about 8 hours, and it sometimes you could develop a hernia or something like that. I was like, damn it, I don't need all of that. And they say sometimes the insurance don't cover that one, maybe. So I was going with the one where you take the fat from the back, but then she said she didn't like what he said. She didn't like the notes that he put in after this visit. Do I get someone to help me? No, I don't think so. If I need someone, I could ask for it, I guess. When I did the knee replacement surgery, I had to get some, because I used to have, someone used to come to the house. I used to get a nurse visit. I used to get like a physical therapist for the first 2 weeks or so. But I don't know about this. I have to ask them. I have to go in on October 6th for them to tell me all the do's and don'ts before what I have to do before the surgery. You just called me this morning and tell me all of this earlier this morning. And she said they're gonna send some stuff out to my doctor first and see if I need to do a EKG. But I think I just did a EKG recently, so I don't think I need to do another one. They won't pay for another one already. And see if I need to get any blood work and stuff like that. They're gonna send the information to my regular doctor and get clearance from them. But if they have stuff that I did already, then they're gonna just use what they have, the information then that they have there. If I did one recently, then I don't have to do it again. Make sure you change your diet and what you eat. Yeah. Since chemo, I haven't really been eating like that because when you do chemo, it makes you feel so bad. It's like you can't even eat nothing. Everything tastes nasty. So this Tuesday coming is my last chemo treatment. Like another 6 hours. You have to be up at the hospital 6 hours doing chemo treatment. But they say after you do the breast surgery, you still gotta do like treatment every 3 weeks for a whole year. But it's not chemo. It's just like stuff to replace the some medication. But I forget what she tell me. It's for the breast, but it's not chemo treatment. And I have to do that for a whole year. The heart to replace the heart. Some I don't know. It's so much information you gotta take in. Half of the time I can't remember. What did they tell me? I know she said that. I was like, what? I thought I'm gonna be over with that. But long as it's not chemo, long as it's not gonna have these side effects that what the chemo treatment do. 'Cause chemo does have you jacked up. You vomiting, diarrhea all the time. Your mouth tastes like sandpaper. You just wanna vomit all the time. Chemo have me feel very jacked up. It's not a good feeling when after you do chemo treatment. And my nails them hurting me so bad right now. I don't know. It's so mm. I'm sleepy right now. I'm trying to get these subscribers to move faster, but I don't know what the frick I don't know what I'm doing wrong. We're at 3,667. Might get 1 or 2 subscribers a day. Let me read the comments. Blessings says thanks for sharing. Thanks for watching. The sad part about this, you tell my family members and what's going on. It's like none of them have come to look for me up to now. They don't even call me to find out how I'm doing. They probably be right here watching me on the live and don't say nothing. So freaked up. But hey, can't live for them. So hey, if you don't care, I did call my mom and tell her. She did say do the surgery, but the other day I asked her. That was the first time I went to the doctor. I'd called her that day, and she had talked to the doctor. She said, "Yeah, take them off," but then she's not take calling me or whatever. So I text her the other day and I asked her why she haven't checked up on me yet. She's like, she don't want to be involved. What do you mean you don't want to be involved? She don't want to. What kind of foolishness is that? I said, lady, come on. No, stress out. That fucking shit is. You have to be thinking about all this stuff by yourself. I don't even have a man. I don't have a freaking man to talk to. Nobody to comfort you. You're stressed out. You want to cry, but you don't. You really can't. Really can't do it. Okay, just answer the comments then. Yeah, she said she don't want to be bothered. Well, we have a strange relationship for years, so here. No, them back home parents, they're ready. They're mad at you for one thing and they don't want to talk to you. So she was home up and she had the rest of her life. That's up to her. But she's like, God, this she's telling about God, trust in God, and that's all she ever say. But she did say to take it out, cut it. But so the only people I have right now to talk to is the doctors, the social worker, who has not no family member giving me no input. I if I talk to you guys, but at the end I have to make the last decision. So, but I have a brother. He live right in we live Brooklyn. Tell me one time. One time I tell him to come over to whatever my when my kids just give me a lot of problem to come over here and talk to them. He was like, oh, he have his own family, whatever. I said, so because you have your own family, you're the uncle. So if I'm asking you the thing, you're telling me you can't just talk to them. You know what I'm saying? Because I only have boys now. You know, boys don't like to listen. Now. They don't. Girls don't listen either. But I don't have no girls, so I don't know what having a daughter feel like. I only have four. I have four brothers too now. Four brothers and four sons. I don't have no sister. Okay. Thanks for hanging out with me. But I'm not gonna stress about it. Shit. It is what it is. I just come on here and smile like everything is okay, just the same. You know, is that what could I do? I can't control anything. I could only control what happened to me. I am the stone that the builder refused. So I'm just gonna watch a lot of videos, learn something from other people who went through this situation already. Pray for the best. That's it. That's all I could do. Oh, like the stone. I'm like the stone that the builder refused. I was playing that song a lot yesterday. All day yesterday I was listening to that song. It's limited, I don't know. No, this song.
That King of blood and righteousness, I dare not trust the sweetest frame, but only lean on Jesus' name.
On Christ the solid rock I stand. get a longer version of this. It's cut off too fast.
I want it for people to go pound, you know. I say, you see, I like me. Come on, you too. I like you that amount to nothing. But guess what? You see, when I'm dead, just tell somebody to go and dash it for man. Cause you know what? A price make with the head and cornerstone. Let me talk to you. You see that stone?
You see that stone? You see that stone that the builder refused?
Silver stone. Guess what?
Oh, yes, it was.
My God.
The head of the water. I'm like that stone.
Just like that stone.
I'm like the stone that the builder refused.
Look at me now.
Oh, I have become. Oh, I have become. The head of the
I want it for
water.
people to go pound, you know. I say, you see, I like me. Come on, you too. I like you that amount to nothing. But guess what? You see, when I'm dead, just tell somebody to go and dash it for man. Cause you know what? A price make with the head and cornerstone. Let me talk to you. You see that stone?
You see that stone? You see that stone that the builder refused?
Silver stone. Guess what?
Oh, I'm like a stone.
Just like that stone.
I'm like a stone that the builder refused.
Look at me now.
Oh, 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 oh. The head on the
I want it for
water.
people to go pound, you know. I say, you see, I like me. Come on, you too. I like you that amount to nothing. But guess what? You see, when I'm dead, just tell somebody to go and dash it for man. Cause you know what? A price make with the head and cornerstone. Let me talk to you. You see that stone? You see that stone? You see that stone that the builder refused? The silver stone. It has become. Guess what? No, it has become. My God. It has become.
The head on the water. I like the stone. I like the stone.
Just like that stone.
I like the stone that the builder refused.
Look at me now. I want it for people to go pound, you know. I say, you see, I like me. Come on, you too. I like you that amount to nothing. But guess what? You see, when I'm dead, just tell somebody to go and dash it.
Don't dash
You know
away.
what? A price made with the head and cornerstone. Let me talk to you. You see that stone?
I see that stone.
See that stone?
I think it's reconstructive.
Guess what?
I think it's reconstructive. I said surgery. Reconstructive surgery. I like that stone.
Just like that stone.
I'm like a stone that the builder refused.
Look at me now.
Head on the
I
water.
want it for people to go pound, you know. I say, you see, I like me. Come on, you too. I like you that amount to nothing. But
Reconstructive.
guess what? You see, when I'm dead, just tell somebody to
Reconstructive
go and dash it
surgery.
for man. Cause you know what? A price make with the head and
Reconstructive surgery.
cornerstone. Let me talk to you. See that stone? See that stone? See that stone that the builder refused? The silver stone. It has become. Guess what? No, it has become. My God. It has become.
The head on the water.
I am like that stone.
I like that
I
stone.
am like that stone. Just like that stone.
I like that stone that the builder Am I saying it wrong? Constru.
I want it for people to go power, you know. I say you see a lack of me. Mind you too. A lack of you that amount to nothing. But guess what? You see when I'm dead, just tell somebody say do that shit for man. Cause you know what? A price make me the head and fall on a stone.
Reconstructive.
Me talk to you. See that stone? See that stone? You know what? See that stone that the builder rebuilt. The silver stone. Guess what? Now it has become. My God. Now it has become.
Let's find this song because this thing is too short. I see the stone. Reggae version. The stone that the builder refused. Reggae version. Did this?
Hey, hear me good now. I want it for people to go power, you know. I say you see a lack of me. Mind you too. A lack of you that amount to nothing. But guess what? You see when I'm dead, just tell somebody say do that shit for man. Cause you know what? A price make me the head and fall on a stone. Me talk to you. See that stone? See that stone? You know what?
Do you see that stone that the builder
The silver stone. Guess what? Now it has become. My God, now it has become. Just like that stone. Look at me now.
um paper paper.
Disrespect me. That I'm gonna feel those things against me. That condemn me. From me a baby. I pass a judgment and they know me no guilty. They try to limit the mental capacity. Stick on the physical ability. But spiritually not the same. When they see me legacy, go tell them to see reality. Man a royalty. When they see me fun and top in a man pocket. No me not be shame for me testimony. See that stone? See that stone? That stone, that stone.
Do you see that stone that the builder refused?
Look at it
Oh,
now.
it has become. Oh, it has become. The head of the stone. Stone that the builder refused. I see that stone. King Arthur, 6 years ago. Doing that shit with, doing that shit with, doing that shit with. dash away. Don't dash away. Don't dash away. Oh, my hip.
Yo, Ali, reggae. Hey, hear me good now. I want the people to go power me now. You say it's not like me. I'm like you don't amount to nothing. But guess what? This is one again. Just tell somebody to do that shit with man. Cause you know what? I price me with the head and kind of stone. Let me talk to you. See that stone.
You see that stone. You see that stone that the better with you. Hip hop, hip hop. It's big body wearing me dog. You see that stone. You see that stone that the better with you. I'm like a stone that the better with you. Oh, my hip. My hip cramping. Don't dash away. Don't dash away. Don't dash away. Come on, guys. The cash app is running. The cash app is up and running. Got something up in there. Don't dash away. 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 You see that stone that the better with you. Don't dash away. 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 Don't dash away.
Yo, Ali, reggae top 10. get a drum as a toy for Christmas. Was one of the greatest innovators. The note and the right. There's a whole yard full of pans. Bandulu. Bandulu. The note and the right. Bandulu. The note and the right. Bandulu. There's a whole yard full of pans.
Thanks for watching, everybody. Keep watching, like, share, and subscribe. We out.